Today I'll be talking about a patient who had visited me complaining of pain in both the legs. The patient had excessive pain on walking and standing for a long duration of time, and this patient told that he got relief on sitting down for some period of time or on bending forwards. Now, what could be this particular problem? Let me answer that puzzle for you. This is something called as spinal canal stenosis. Spinal stenosis occurs when the space inside the backbone or your spine becomes less. Now, why is it important? Because when the space becomes less, it applies pressure over the spinal cord and the nerves coming out of it. Let me explain this with the help of a model. Here we have the backbone. Okay, this you're looking from the front. This is the backside view, and these yellow things are the nerves coming out. Now I'll just put this needle in this one small space. This is called as the foramen or the canal through which this particular nerve comes out. Now what happens in stenosis is this particular space becomes narrowed, applying pressure over the nerve. Let's have a look at the symptoms. Because of increased pressure over the nerve, there can be tingling, numbness, followed by increased pain whenever the pressure increases. Now, what are the points the pressure increases? Pressure within that narrow canal increases when the patient is standing for a long duration of time as well as walking, which explains why pain is more in these particular conditions. And the pressure gets relieved when the patient sits down or bends forwards, resulting in relief of symptoms. One of the commonest causes is a large herniated disc. Whenever there is a slip disc, the disc can compromise the space within the spinal canal, resulting in a canal stenosis. Other causes could be an injury, spinal injuries, thickened ligaments, tumors, etc. One is a simple blood investigation to rule out infections or inflammations. An X-ray of the spine. An MRI of the spine is a very valid tool which helps in identifying the soft tissue problems which are present. It is broadly divided into two. One is conservative followed by interventions. Conservative involves usage of medications. Medications include nerve numbing medications which we usually prescribe to the patient, and apart from that, physiotherapy. Physiotherapy plays a very vital role because most of the patients suffering from these problems are in the older age group, and it's important to strengthen the muscles. Interventions include something called as the epidural interventions. Now, epidural interventions are targeted injections using image guidance, which is done close to the nerve root to decrease the inflammation which is caused by excessive pressure over the nerve roots. If you or your near or dear ones suffer from similar problems like this, it could be spinal canal stenosis. So it is best to get it evaluated, then do pay us a visit at Alleviate.